8:13, another beautiful day in southeastern Louisiana. Highs around 66 or so. Right now it's kind of chilly. We're joined by Dr. Brent Wallis, our friend. Dr. B, Chief Medical Officer of People's Health. How you, Doc?
Hey, Tommy, I'm doing good. It's chilly, definitely.
You like it or not?
It's okay. I had to turn the heat on last night.
Uh-oh. Highs of 60s. I did too, actually. And that, it's cold. If I turn the heater on, it's cold.
Yeah.
Definitely. So whether you're newly approaching 65 or if you've had Medicare for years, there is a lot to learn about the program, and Dr. B is here from People's Health. Talk about Medicare and dispel some common Medicare myths. And I guess before, Doc, we start talking about myths, we should talk about Medicare. What is Medicare?
Yeah, sure. So Medicare is really just a government-funded health insurance program, and it provides health care and benefits to people who are usually age 65 or older, but it can also include people of any age with certain health conditions or disabilities as well.
How is People's Health connected to Medicare?
So People's Health offers Medicare Advantage plans throughout Louisiana, and Medicare Advantage plans are provided by private insurance companies, so not the government, but they do have a contract with Medicare in order to provide those plans. And the plans have to cover all the same services that original Medicare does, but a lot of them offer extra benefits as well.
What are Medicare Advantage plans?
Yeah, so Medicare Advantage plans actually provide a lot of extra benefits that original Medicare does not. So it can bundle various benefits and services that you may need, and that can be really convenient for a lot of people that need additional care.
What about some myths? First, is Medicare, people think maybe is only for older adults?
Yeah, that's not true, actually. While a lot of people are in older age groups, you can definitely be younger than 65 and still qualify for Medicare programs. You might get Medicare earlier if you have certain types of disabilities, or if you have something like ALS or Lou Gehrig's disease, or if you have end-stage renal disease, so end-stage kidney disease, you qualify for Medicare as well.
I've been talking to you for years, and I didn't even know that. Does Medicare have only two parts?
No, there's actually four parts to Medicare. I know we've talked about this before, parts A, B, C, and D. And so kind of the quick way to remember it, Part A is all of your hospital insurance. That's going to cover everything you get when you're in a hospital facility or a skilled nursing facility. And then Part B is the medical insurance side. So that's going to cover all of your outpatient doctor visits and preventative care, all of those services that Part A doesn't cover. Part C is Medicare Advantage plans, things like People's Health. And then Part D is for drugs, so that's the prescription drug coverage. And you can get Part D through either standalone plans if you're on original Medicare, or if you go with Medicare Advantage plans, often the Part D is bundled in there as well.
So what parts make up original Medicare?
Yeah, so original Medicare only includes Parts A and Part B, so it doesn't include any of the prescription drug coverage.
Are you automatically enrolled in Medicare?
So it depends. Some people are automatically enrolled in Parts A and B, but some people have to sign up for coverage. So you have to kind of be aware of what's going on, make sure you're checking your mail. You can definitely contact the Social Security Administration to find out whether you're going to be automatically enrolled, or you could even visit the Social Security office or give them a phone call, and they'll explain the program to you and what you are enrolled in.
Does everyone pay the same amount for original Medicare?
No, they don't. So original Medicare is definitely going to cover the same services for everybody, but the costs are going to vary from person to person. And most people have to pay a monthly premium for original Medicare Part B, and the amount is going to be based on income, usually income that you made in the past if you're not currently working. So that means some people that had a higher income may pay a higher premium than others when they sign up for Part B. And then some people can also get help paying those Medicare costs from something called a Medicare Savings Program. And those programs actually can either cover part or all of your Medicare premiums, and they can even help out with some of the cost sharing for people that have, limited income. And you can find out about those Medicare savings programs at the Louisiana Department of Health website. So ldh.la.gov will give you more information about those.
A text pops up here. Is Original Medicare all you need?
Yeah, it really depends. Everyone's health care needs are different. And so Original Medicare is going to cover most of the medically necessary benefits that you might need, in a hospital, at a doctor's office, or another healthcare facility. But it's not going to cover those additional services that we've talked about before, things like routine dental care and vision care. Those are not included in Original Medicare. And like I was just saying before, Original Medicare does not offer Part D prescription drug coverage at all. So that's why a lot of people may choose to enroll in a Medicare Advantage plan, because remember, those plans cover all of the same things that Original Medicare does, but they offer those extra benefits, dental, vision, and hearing. Some offer a fitness club membership, which is nice for people who want to get out of the house and keep themselves healthy. They may even offer credit allowances for things like over-the-counter health and wellness items. And then most Medicare Advantage plans also include Part D prescription drug coverage. So like I was saying, it's all bundled together, and you don't have to enroll in a standalone drug plan.
But that being said, there are differences between Medicare Advantage plans.
Yeah, there are definitely. Not all Medicare Advantage plans are the same. Everyone is going to have slightly different costs and benefits. And so some Medicare Advantage plans may even have an annual deductible or a monthly premium that you have to pay in addition to your Medicare Part B premium. But there are plans, Medicare Advantage plans, a lot of people's health plans, in fact, that don't have any annual deductible, and they have a $0 plan premium, so you're not paying any extra per month. But, really, regardless of what you decide to choose, in general, your overall cost with a Medicare Advantage plan is typically going to be lower than under Original Medicare. And the main reason for that is because Medicare Advantage plans are required to limit your yearly out-of-pocket costs. So what that means is you hit a ceiling or a cap on cost every year, and you don't get charged anymore, whereas Original Medicare doesn't have that ceiling. So if you have a really serious illness or a complication, or you end up in the hospital, you may have really high bills.
Let's take a second. We'll take a break, reflect on what we've heard so far, and we'll talk about comparing Medicare Advantage plans when we come back. We're talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health. Whether you're newly approaching 65 or if you've had Medicare for years, there is a lot to learn about the program, and we're trying to dispel some common Medicare myths, and we will continue when we come back on WWL 821 now. Time for traffic, WWL. 826, Tommy Tucker, WWL. Quickly back to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Whether you're newly approaching 65 or if you've had Medicare for years, there's a lot to learn about the program, and we're talking about Medicare myths. And Dr. B, I guess we'll pick it up with Medicare Advantage plans. How do you even go about comparing these things?
Yeah, you really do want to know what you're signing up for. It's very important that you find a plan that really works with your budget and then also covers whatever your healthcare needs are going to be. So you want to look at a couple of different things. You want to look at what are the costs of the plan, what benefits are included, and then are the providers that you want to use in the network as well. And then another thing when you're comparing is look at the plan star rating. The star rating is something Medicare uses every year to measure how well the Medicare Advantage plans performed across a bunch of different categories. And they include things like member experience. So did the members of that plan have a good experience in their health, in the prior year? And so plans are rated on a scale of 1 to 5 stars, and a higher star rating means a higher quality plan. And most people's health plans, including our special needs plans, are rated 5 out of 5, again, for 2024. That's our third year in a row that we've earned that highest Medicare star rating, so we're super excited and very proud of that.
And that's the only one in the state and one of only 32 in the country, right?
Yeah, it's pretty rare, actually. So like I said, we're very proud of that.
And lucky to have it here. Can you enroll in a Medicare Advantage plan whenever you want?
So generally, you have to enroll during what's called the annual enrollment period, and that's the period of time that's going on right now when you can change your Medicare coverage. And that means you can either enroll in a Medicare Advantage plan or you can switch from a plan back into original Medicare. And that runs from October 15th to December 7th of each year. So really right now is when you want to be looking at all of that. And then, there are some what we call special enrollment periods that let you make changes at other times of the year, but you have to meet certain criteria, and it's not guaranteed. So really this is the most important time of the year to be looking at what your needs are going to be, and do you need to change your coverage at all.
What's the best way to find out about Medicare and Medicare Advantage plans?
Yeah, really one of the best places you can go to is to the government website. So go to Medicare.gov, and there's a ton of information on there, a lot of educational information, information about what services are covered and what's not. But what's nice is they have a really cool tool on there that allows you to put in your zip code and who your doctors are and what medications you're on, and it'll show you all the Medicare Advantage plans that are available in your area. You can kind of compare them side by side and make sure you're making the right choice for yourself or for your loved one.
And if people want to find out more about People's Health?
Yeah, for us, you can go to our website at peopleshealth.com. We've also got an in-person option. It's our Medicare Center that's in Metairie. You and I were over there a couple of weeks ago.
Mm-hmm.
It's right on Veterans at Party City at the Causeway intersection. We've got a lot of in-person benefit discussions going on over there, so you can see those at peopleshealth.com/meetings, or you can just sit down and talk with somebody and learn about Medicare itself or anything that People's Health may offer as well. So definitely come by and see us.
Yeah, take advantage of those in-person benefits presentations. You can walk in. Appointments are recommended. Thank you, Dr. B. Appreciate your time.
Thanks, Tommy. Have a good weekend.
You too, sir. Peopleshealth.com. Go there, and then it'll lead you to everything you need to know. The Medicare Center is at 3017 Vets. That's right next to Party City. Appointments are encouraged, but they'll take care of you if you would just walk in, take a break, come back, talk about LSU Bama here on WWL.